Thank you all so much for the invitation to welcome everyone to this meeting, and thank you as well to the organizers. As Richard Frank has already noted, today's workshop will examine the mechanisms and organizational behavior change initiatives that can improve care and better support the needs of people living with Alzheimer's disease and related dementias, with a specific focus on how payment policies, which we all recognize are a critical incentive, how they can be optimized to change organizational behavior. NIA leadership is excited about the range of topics on today's agenda, from the evidence on what constitutes quality care for people living with dementia and current payment models to the identification of gaps in data on payment for services. We'll close the discussion with by talking about the application of insights from the social sciences for implementation of payment models that effectively promote high quality care for people with Alzheimer's and related dementias. Thank you for taking the time to join today's meeting. I'm looking forward to the discussion and hope to stay on the meeting for quite some time. And with that, I will turn it back over to Theresa and the organizers to continue the welcome.
Thank you very much. So it's my pleasure to discuss with you mechanisms for organizational behavior change to address the needs of people living with Alzheimer's disease and related dementias, or AD and ADRD. Again, my name is Theresa Kim, and I wanted to take a moment to thank my colleague, Dr. Priscilla Novak, who worked tirelessly to make this workshop happen, along with Dr. Frank and our panelists who are participating in this workshop. So I'm a new program official, so I'd like to give details about who the National Institute on Aging and DBSR are. So the National Institute on Aging is one of 27 institutes and centers of the National Institutes of Health. We understand the nature of aging and extend the healthy, active years of life. The Division of Behavioral and Social Research is one of the 4 extramural divisions of NIA, where we focus on social, behavioral, and economic research and research infrastructure and training on the processes of aging at both the individual and societal level. We fund cross-disciplinary research at multiple levels, from genetics to cross-national comparative research, and at stages from basic through the translational research. One of our foci is on Alzheimer's disease and Alzheimer's disease-related dementias research, in addition to life course health and aging research. We at the Division of Behavioral and Social Research are managed across 2 different branches, the Population and Social Processes team and the Individual and Behavioral Processes team. PSP focuses on demographic and institutional and other factors at the population level, including health systems such as Medicare and Medicaid, and other national representative longitudinal studies, where we like to see the generalizability of research results, and also the individual and behavioral processes, where we fund research on psychological, behavioral, and interpersonal processes at the individual and dyadic level. So you can learn more about us here at the link included below. Next slide, please. Thank you. So we're an extramural team. What is the relevance of this workshop to the National Institute on Aging? We focus on receiving input from experts. Every 5 years, the National Advisory Council on Aging recommends future directions. Some 20 to 25 recommendations are relevant to this workshop today, and we hope to develop our program via these recommendations. The 2019 NACA review recommended that we support individual and organizational change research and support research improving care for AD and ADRD patients and caregivers. Next slide, please. So for our objectives, the purpose of this workshop is to identify mechanisms in the health system that will improve care of those with AD and ADRD. We're hoping that for today we'll go into these received recommendations that we've learned from external experts to solicit innovative more research. We'll do this more deeply, because while many health systems and public health and social service systems are redesigning their programs and processes, we want to address the current siloed nature of care and service delivery. There's still a research gap in understanding how to reliably implement organizational change initiatives to better serve people living with AD and ADRD, and that's what we hope the workshop will be able to answer those questions. Next slide, please. So this is the conceptual model that we considered for this workshop, with a Donabedian model of system function, where a health system receives inputs and follows processes and then produces outcomes. In this case, we're considering payment, because we know organizational behavior is defined as the systematic study and application of knowledge about how individuals and groups act within the organizations where they work. And we are looking into how payment can potentially have a relationship with organizational level productivity or other health outcomes such as patient survival. Next slide, please. So as we say, payment is central to inputs and processes. The available evidence suggests to us that how healthcare is paid for can influence the processes and outcomes that organizations produce. We take a look at the example of accountable care organizations. These ACOs work across all types of care. We want the most efficacious type of healthcare, and that for also to be reimbursable, and see how well people maintain their health. We'll look at other things besides payment, but at this moment, we don't know the directionality of such payment policies for people with AD and ADRD, and we hope that this workshop can help us solicit more research that can determine the direction of payment policies for patients with AD and RD. Next slide, please. And thank you so much. Here's my contact information. It is my pleasure now to hand it back to Dr. Richard Frank as he introduces our following panelists. Thank you.